Okay, so we're going to be doing a cervical real-time evaluation. This is Emily, I'm Alyssa. So to start the cervical real-time evaluation, we're going to start with palpations. So I'm going to move her hair out of the way and I'm going to have her look down for me. And the most outer part here is going to be C7 that pops up. So you can feel the spinous process is C7, you can work your way up to C6, C5, C4, C3, and that'll lead you to the occipital bone. From there, you can find the longissimus capitis muscles that kind of form a triangle this way. And then from there, you have the rhomboids that come up here, and you also have levator scap. If you come onto this side, she has her scalings here. If you look that way for me, coming off the mastoid process, this muscle that sticks out is the sternocleidomastoid. And then if you find the collarbone and go just right above it into this point, you'll find Erb's point where the first rib is. So that's all for, palpations. So next is going to be active range of motion. So I'm just gonna ask her to touch her chin to her chest. I'm gonna have her look up as far up to the sky as far back as she can. I'm gonna have her look to the side that way as far as she can. I'm gonna have her look to the side that way as far as she can. I'm gonna have her look back at me, and I'm gonna have her take her ear to her shoulder as far as she can, and do the other side. From there, we can go into medial muscle test. So I'm gonna ask for her consent to put my hand on your face. So I'm gonna have her push her head into my hand, and that's testing both of the sternocleidomastoids at the same time. If I put my hand over here and I ask her to pull her ear to her chest or into to her shoulder, that would be testing her scaling muscles on this side. If I were to put my hand here and I would have her turn to look this way, this would be testing the sternocleidomastoid on this side. And then if I have my hand here and I have her push back, that would be testing the upper traps and levator scap muscles. So then from active range of motion, I'm gonna have her lay down on her back with her head hanging off the edge of the table. I'm gonna have her relax, and it'll be easier if in a chair, but I'm gonna do passive range of motion, so I can passively move her into some flexion, passively move her into extension. I can passively do some lateral bending, and once I get back to neutral, I can have some passive rotation. From here, if I laterally bend her and push on her shoulder, this is going to be the brachial plexus traction test on this side and the compression test on this side. And then I can also, if I extend and laterally rotate, I can test the vertebral artery. So now I'm going to have you sit up for me. From here, moving into special tests, we have the cervical compression test. I'm just going to have her sit up as straight as she can with good posture. I'm going to interlock my fingers together and just apply some downward pressure on the spine, and that is just testing for a nerve or injury. We're trying to replicate symptoms if there are any radiating pain down the arm, or if she has pinpoint pain specifically in her neck. That could be a facet issue. To get more pinpoint of where it's at, I could have her look back a little bit and lean to the side. And this will be the Sperling's test. Same thing, just pushing straight down, and that would be the same thing. So nerve root if there's radiating pain down the arm, or a facet joint if it's pinpoint pain in the neck. From there, I can ask her to cough or like pretend like she's blowing into a balloon. And if she has any pain in the back of her neck, that could mean a herniated disc. Then going into TOS test, if I find her radial pulse on here, and then I go straight back and I have her look to this side.
Which side?
To your right. And this would be the Adson's test. I'm feeling for that pulse to see. I can also ask her to hold her breath for 30 seconds to see if that pulse diminishes. The test would be positive if her pulse diminishes, and it would mean that there is scaling involvement. So then if I move her into this position and I have you look to your left, this would be the Allen's test. And the same thing, if the pulse diminishes, this would just mean that she's positive for TOS with PEC involvement. The last TOS, or no, not the last TOS test, but would be military brace. So here, and if I have her look up to the sky for me, this would be positive if the pulse diminishes, and it would be positive for first rib or cervical rib involvement. one more test would be the roots test. So up here, and just moving your fingers up and down. You can do this for 3 minutes, and any signs would be like if her arm drops or any numbness or tingling, that would be positive for TOS, and then you can stop. And then one last test, I'm gonna have you lay down on your stomach, and then you can relax with your hands on your head all the way down for me. This will be the spring test. So you want them laying down for this one just so there's no muscle guarding, but finding that C7 spinous process and just adding a little bit of spring and just testing to see if it causes a spasm or if there's any extra movement, and that's it. So then if you sit up for me, for a cervical evaluation, you're always gonna do dermatomes and myotomes, so we're gonna go through those real quick. So starting with C4 will be upper traps. I could have her shrug her shoulders and push down. C5 would be here. I would have you go here, and I would push down there. I'm gonna have you go like this for me. C6 would be thumb and first finger. I'm gonna have you curl your hands up here, and then don't let me pull them down, testing the biceps. And then go back down here. C7 would be the middle finger. I'm gonna have her go to this position again, but I'm gonna have her push against me for triceps this time. Go back here for me. C8 would be pinky and ring finger, and then this would be grip, so I'm gonna have you grab my fingers and don't let me pull my fingers out. And then for T1, I'm gonna have you go back to this position, medial elbow, but this time I'm gonna have you splay your fingers and then just squeeze in there.